Welcome and thank you for joining us this afternoon. My name is Darren Szilagyi. I'm the Chief Marketing and Strategy Officer for Trinity Mother Frances Hospitals and Clinics. We have joyful news to share with you today. We have multiple speakers who will take you through part of our story for the afternoon. For those of you in the media, there'll be a set of question and answer time at the end of our presentation. We will administer that at that time. Our first speaker for the afternoon is Mr. Lindsay Bradley, the president of Trinity Mother Frances Hospitals and Clinics.
Good afternoon. Thank you. This is a very important day in my life and in the life of Trinity Mother Frances Health System. I'm getting a little bit of feedback. Is it? Anyway, welcome. I'm very glad you're here. We certainly appreciate the media and the press for being here because this is an important event for our organization and it's an important event for the people that we serve in East Texas. I think it's important for a minute to reflect on 1937 in East Texas. There were no hospitals. The Sisters of the Holy Family of Nazareth came with their sisters from Chicago to staff and run that hospital in those days in the East Texas oil field. And so that was the first. It was the first hospital in East Texas. And over the years, there have been a number of firsts. One of their firsts was that they invited me and Ray Thompson to come here in 1981, and I've had the privilege of being the Chief Executive Officer here for 35 years, so I've seen some marvelous things happen. And I think it's important to reflect that we are one of the largest employers in East Texas. We're centered on our patients. We're doing it very well. We're very proud of a number of the firsts that we've achieved. We created the Trinity Mother Frances Health System and integrated with the Trinity Clinic physicians. We have many significant partnerships with private community physicians throughout East Texas and look to make that better. Our organization is successful. We had the first air ambulance program. We started the first heart program, the first neonatal ICU, and I could go on and on. So we've tried to be ahead of our time. We've tried to plan and anticipate and think ahead. And for the last year and a half, we've been in a very in-depth strategic planning process about how do we adjust to the changes in American healthcare. We know that our customers and our businesses and the government can't afford what we're doing. And so we have to think of new ways to organize ourselves so that we can serve people in a bigger and better way. We have to learn how to sustain wellness instead of only being here when they're sick and showing up in the emergency department. Those are part of our mission. We know that we're going to be paid differently. And so we need to anticipate and get ahead of that so that when that time comes and we're actually paid to help people stay healthy and manage their chronic diseases, we want to be prepared. And that can only be done when we work in collaboration with our physicians and all of our teams, a lot of support staff. And so we're very proud of all those things. And as we looked out across the future, we see great opportunity. It's a moment in time. It's a moment of change. We're founded in the Catholic mission of healthcare in East Texas. We've been proudly doing that from the very beginning. And we've decided that we would be best advantaged to take care of the opportunities to serve an even broader area of East Texas by seeking out a partner. And so for the last 9 months, we have been in a very organized process to identify a partnering organization that shares the same culture, the same vision, the same strategies, and has a reason to want to expand and grow healthcare in East Texas, Catholic healthcare in East Texas, not serving just those that have insurance, but those who are disadvantaged and have limited access to care. And so that's our mission. We want to grow. We want to serve even more people in East Texas. And through a very important, hard, time-consuming process, we've evaluated opportunities with a number of important healthcare organizations. We've learned that we have a very valuable health system, that we're doing things in a unique way, not just in Texas, but around the country, because we have a shared medical record, we have a shared commitment to taking care of people on an outpatient basis as well as we can, and we want to grow those things, and we want to include our community doctor partners as well. So at this moment in time, we see great opportunity, but we felt like that we could take advantage of that now better by finding a compatible organization, a compatible partner. And I'm here today to tell you that we have. We're very proud to announce that we're going into a partnering and a coming together with CHRISTUS Health. They're Texas-based. They've been in Texas for 150 years. Trinity Mother Frances and our sisters have been here for 80. We have done a very in-depth evaluation of the opportunities and the cultural fit, and it's fantastic. So we're announcing today that we have signed a letter of intent yesterday and are going into a process of all the due diligence where the lawyers and the accountants do all the things they need to do. But the purpose of this is so together we can find even better ways to take care of people. We're excited about what we're doing, but we know we need to change, and we think we can change faster in a more lasting way by partnering with CHRISTUS Health. The Sisters of the Holy Family of Nazareth will join the sponsors of CHRISTUS Health so that they become partners in directing healthcare, not just in East Texas, but across the state of Texas, into Louisiana, New Mexico, and internationally. And we see this as a great opportunity to extend the healing ministry of Jesus Christ, and we're very excited about it. And so my colleagues will tell you a little bit more about the process. We're excited. This is one of those moments in time where things are changing, and we think are changing in a very positive way. Let me say to you at this time, Trinity Mother Frances is in fantastic condition. There's some, there are rumors that go around, well, you may be doing this because you have financial trouble or you have this or that. Nothing could be farther from the truth. Trinity Mother Frances is a preferred brand of healthcare in East Texas. We're very proud of that. We take it seriously, and every day we try to get better. And so by working with CHRISTUS, we think we can get there even better and faster, and we're very excited about it. We appreciate you being here, and I'll turn it over to my colleague, Ray Thompson.
Good afternoon. Appreciate you being here. What I want to tell you about is what we learned during this process of looking for potential partners. Number one, we learned that Trinity Mother Frances is absolutely one of the highest quality organizations in America, not just in Texas or East Texas. And during that process, we realized that our business model of providing care to patients and service to patients was really the driving force. And we also learned that our partnership with our Trinity Clinic doctors was unbelievably valuable. And it's been a great, great business model for us. And I think in the future, our partnering with CHRISTUS will allow us to continue to provide fantastic, high-quality health care to the people of East Texas for the years to come. And I think that's the key to this whole press conference, is to talk about what this partnership is going to do for health care in East Texas in the future. And that's the key, and I am very proud to be part of CHRISTUS and their system, and I think it's going to be one of the greatest things for health care that ever has happened in East Texas. And I hope all of you realize how great it is for this community and all of East Texas. So thank you for being here.
Good afternoon. I'm Dr. Steve Coy. I'm Chief Medical Officer, President of Trinity Mother Frances, and President of Trinity Clinic. And I want to share the excitement about this day, this partnership, and this announcement with CHRISTUS Health. Let me describe just briefly the process we went through. We had a strategic plan in which this discovery of whether we should partner with another health system was on the table. And so 9 months ago, we formed a steering committee. That steering committee consisted of 4 physicians, system board members, some of our sisters were on this, some of our vice presidents, and others that formed this steering committee. The first thing we did is we asked ourselves, what is the most important thing that we need to get out of this? What do we need to become more successful and meet the needs of healthcare in East Texas? And so we made a list of things that we had to have, the most important things. And that formed the basis of our looking at other health systems. We evaluated proposals. We had many. But just to cut to the chase, we cut it down finally to 2. We then did site visits. Those systems came and visited us, and we went on trips. I think we did about 9 or 10 trips to different health systems to see what it's like to be a part of that health system where care is actually being delivered. We talked to physicians, nurses, administrators, patients, and board members in all of these facilities. And after that, we concluded that CHRISTUS Health was the partner for us. The reason for that is we share a common vision. The mission of CHRISTUS Health is to expand the healing ministry of Jesus Christ. And that's the same ministry that we have, the same mission that we have here at Trinity Mother Frances. Also, the CHRISTUS leaders and the people we met are people that we can trust, that we can work well together with. We actually did a cultural assessment of CHRISTUS compared to us, and there was a good match of mission, vision, and values. And so, with a patient-centered approach in both CHRISTUS and Trinity Mother Frances, realizing the opportunities that are out there in East Texas to provide better and more care and to grow, we announced this partnership today with great excitement. Our physician board unanimously approved this, as did our system board and the sisters. And so we have full support to move ahead, and we're excited. Thank you.
Good afternoon. My name is Dr. Scott Smith. I'm Senior Vice President here at Trinity Mother Frances. And as previously mentioned, we considered many different angles and viewpoints before we considered this partnership going forward with CHRISTUS Health. To do so, we wanted to make sure we maintained the strong trust and the reputation that Mother Frances has earned from each of you. And we were looking for an organization that could help us grow throughout East Texas and beyond. I'm happy to say that CHRISTUS met all of these requirements. We came up with at least 20 must-haves for a partnership organization to work with us. Must-haves such as maintain our Catholic-based heritage and our faith-based healing ministry through healthcare. Maintain the relationship with Trinity Clinic, our large multi-specialty clinic that we have, and also the commitment to growing independent relationships with independent physicians. Also to help us grow our capital funding plan. We have renovations we would like to occur here at the Mother Frances campus, and also grow throughout East Texas by growing new primary care and specialty care facilities. We went through all of these, and CHRISTUS met all of them. Most importantly, whenever we did our reverse site visits and we went to the CHRISTUS facilities and met their leadership and got to know them more, we felt there was a very strong blend of culture, that not only are they dedicated to patient-centered care and improving health care in the communities where they were also dedicated to doing it through the healing ministry of Jesus Christ, as what Dr. Coy stated. So we could not be more pleased at this partnership today, and we look forward to growing our healthcare services throughout East Texas and throughout Texas as we start this new day in partnership with CHRISTUS Health. Thank you.
Hello, my name is Ernie Sadu, and I'm the CEO of CHRISTUS Health. And I just want to share with you the excitement that we have within CHRISTUS Health to be able to be a part of this partnership and to join with such a highly credible and leader in healthcare in East Texas. On behalf of our sponsoring congregations, our Sisters of Charity of the Incarnate Word Houston and Sisters of Charity of the Incarnate Word San Antonio, our system board, and our 35,000 associates, this is truly a milestone event for CHRISTUS Healthcare, but also for Catholic healthcare in East Texas. And the ability of our organizations to work together to continue to expand healthcare, to continue to expand the access for all those in need of healthcare, and to focus on the wellness side of healthcare, which is so critical in today's environment. Together, our organizations bring over 230 years of experience based in Texas. We understand Texas. And as you look at the organizations, and has been mentioned here, our missions align to extend the healing ministry of Jesus Christ. Our visions align. Our cultures align. The charisms of our sponsoring congregations, which are the foundations of who we are and how we deliver health care, align and are similar. And that will continue to expand healthcare throughout East Texas by using those strengths and the strengths of Trinity Clinic and the strengths of the independent physicians that are here and all the other providers, of how we can build our resources as we continue to keep our focus of growing so that more and more people can be embraced with God's healing presence. That's who we are. And that's the excitement that we have, because we haven't just come to East Texas today. We've been here a while. And to work together and to have such a tremendous opportunity to work with another strong, reputable healthcare organization in East Texas as Trinity Mother Frances is truly a milestone event. So it's with great excitement that we're here today. We look forward to continuing to meet with you and to talk with you and to share with you and to be able to continue to share the news of the future over the next many years of all the excitement things that we have to put in place to continue to take care of the communities of East Texas. So thank you very much for this opportunity and the tremendous honor that we have to be here. Thank you.
I would be remiss to the whole crowd if I didn't recognize the people that are sitting in front of us here. These are our sister sponsors who were the beginning of all of this. Bishop Strickland, thank you very much for being here. We appreciate your guidance as we work together forward. The board members, we have many of our board members and senior leadership of both of our teams. We have new partners and new friends and new collaborators, and this is about growth, and we have some very exciting plans, and I'm not going to get into them all now, but I think that the presence of Trinity Mother Frances and CHRISTUS will spread even broader across East Texas, and we look forward to serving those people, and we're very excited about this opportunity. Thank you to the media for being here to share this story, and I'm sure you'll want to talk to some of the individuals, and that'll be fine. But again, thank you for being here. This is a great day for Trinity Mother Frances.
That's the end of our prepared statements for today, but we do have times for questions and answers. If you will, raise your hand, and then we'll direct the questions to the appropriate speaker. Yes, ma'am. So the question was, how will this impact patients? And so I'll direct this to Dr. Coyer.
We only see patient care being enhanced through this. As we expand facilities, we will learn new capabilities that CHRISTUS has that we don't have now. We need to grow more. There's needs out in the communities that we can't service right now. So we think patient care will be closer to home for our patients. We'll have better facilities here in the future as well as in the region. So that's one of the main reasons that we've decided to partner with CHRISTUS.
Dr. Smith, you might want to talk about some of that growth in terms of access to care.
Yes, one very specific answer would be increase our number of access points, access to care and access in the hours to care for the community of East Texas. For example, already begun within the last 15 months, we've hired over 33 primary care physicians and nurse practitioners to come to Trinity Mother Frances to help us reach that goal. And we need new locations to facilities to place these physicians and nurse practitioners. Yes. Well, we have probably two on the books for now. One, we're looking for a new facility near the Cedar Creek Lake area, and we're also going to be starting new construction off Grande and 110, and we'll have a groundbreaking ceremony later this month.
Other questions? Yes, ma'am.
With this partnership, how are we expected to impact employees of Trinity Mother Frances? It sounds like you guys are talking about growth, but is there any area where there may be, in fact, the elimination of some positions currently in East Texas?
I don't think you can have a coming together of two large organizations with complementary skill sets without evaluating all of those things. We have not done that. We've signed a letter of intent. We have several months of diligence that we're going to go through. There will be changes, but I don't know, I can't describe those changes to you. But overall, we think this is a growth in jobs, it's a growth in services, it's a growth in facilities. And so there were going to be many, many job opportunities, not only for our existing employees, but for new employees. We're excited about that.
Yes, ma'am.
Name-wise, is Trinity Mother Frances going to be taking over the CHRISTUS name, or how is that going to work?
This is a happy circumstance. We have two very, very powerful brands. Mother Frances Hospital started in 1937, the foundress of our sister's order. That is a cherished name in this organization, and that won't change. Trinity Mother Frances, over the last 20 years, is a well-respected and sought-out provider of care all over East Texas. So it would be a bad mistake to say that's going to change. That will stay. But CHRISTUS, on the other hand, has a very rich heritage and a very well-respected brand. And so it's going to be up to our teams to say, how do we take these two brands and make them work together? Neither one is going to disappear. They're going to work together just like we are.
Other questions? Yes.
You touched on the history of the systems of the hospital, and they've been, such a valued presence here in East Texas, and they have done, so much to be the face of the Catholic Church in East Texas. What is this going to do? Will we be losing them? Will they be staying on? How is that relationship going to work? Will we be getting new systems?
I hope we get as many sisters as we can have. Personal story of Mr. Royce Weisenbaker. This is the Weisenbaker Conference Center, was a board member when I came here. And he said, Bradley, I want you to remember what's different is those sisters. People feel safe with those sisters. You always take good care of them. And I said, yes, sir, and I did that 35 years ago, and I'm still trying to do that. Our sisters are the embodiment of who we are. I hope we get more sisters, but our sisters, the Holy Family of Nazareth, are here. They've been here, and they're going to be here. What's unique about this is our sisters will also become a third sponsoring congregation with the Incarnate Word Sisters over the CHRISTUS environment. And so their sphere of influence and their ministry to people will expand all over Texas, New Mexico, Louisiana, and into South America. So their ministry is even going to grow. So no, they will remain a very critically important part of who we are.
Yes.
On the oversight, there's a lot of change happening with the partnership, but for the people that go to work in clinics and hospitals, how will their daily functions change?
Over the last 24 hours, I think we've had 6 group meetings. We've had this room full of people 6 times in the last 24 hours. We're telling them what we're telling you. Our employees know that we had a strategic plan. We've been explaining it to them all along. We've talked to them about evaluating partners. They've heard that all along. And now we're saying we've successfully found that partner. That will cement our ability to grow and do other things in East Texas. And their jobs are important. They do a fantastic job. Our quality scores, the brand preference scores, all those ways that we interact with people and families are superb, and we're trying to make them even better. So we're here because our employees do that work. We as leaders think about the future and how do we organize around it. But those employees, the nurses, the technicians, the physicians are the ones that care for patients. And they have families and they have responsibilities, and we take that very seriously. And we think this is a growth opportunity. Will there be some changes? Certainly there might be. But I think the net is that there will be more opportunities and more growth and more career options for the entire East Texas area, because we're going to serve more people. We need talented, trained people to do that work. So there will be more jobs net of all this as we go forward. We haven't gotten into any of the details on that yet, the details of how we're going to do all that.
I think a portion of that question was day-to-day impacts, and culture was a big part of this. And so I'd like to ask Mr. Ray Thompson to discuss some of the cultural aspects of the analysis.
Yeah, I want you to know that on a day-to-day basis, this is viewed as an unbelievably positive change. Our employees are highly excited about this. They love the opportunity that is going to come forward because of this relationship. And on a day-to-day basis, our employees will see no change. Their commitment is to their patient and to what we do as an organization today and how we'll do it tomorrow. But what is really important is to understand that a big part of what we did in coming together was taking an assessment of our culture inside of our organization about how our employees operate. And we did an assessment of other companies that we were considering merging with. And what came out of that assessment was that the cultural relationship between Trinity Mother Frances and CHRISTUS Health was beautiful. It was a perfect match. And I think that's why our employees are going to come out of this feeling great and positive. And you know who wins? The patient and their family. And that's the key to the story, I think.
Perfect. Other questions? Thank you for joining the celebration with us today. It's been an incredible day. We hope that you share with us the joy, and we look forward to serving the community for many years to come. Have a great day.